Hi, I'm Swapna from TheHealthSite.com and I'm talking to Dr. Pradeep Moonot, who is an orthopedic surgeon and who has been practicing for over 15 years. Dr. Moonot, could you tell me something about why there are so many cases of calcium deficiency in India, with calcium being prescribed even to infants these days?
In India is a developing country and we have a large population, and in the last 5 to 10 years what we have realized is there is a massive amount of population which are deficient in vitamin D3 as well as calcium, and that's probably because of multiple reasons, most important being the poor nutrition as well as a poor understanding of the whole biomechanics of bone. So bone is a living tissue, and what happens is for the living tissue you need impact exercises, and during your phase of your growth the positive bone, so the bone deposition happens till the age of 30. After that it goes into a negative what you can say cycle. Calcium is taken out from the bone and is used for some other reasons. So till 30 you need supplements, and one of the most important thing is impact exercises, and I think which the present population or the younger population is lacking, where we are spending more time indoors than outdoors. Also the other issue is the main working population not been exposed to the sunlight.
Right.
Where we need minimum 1 to 2 hours of sunlight per day for adequate vitamin D3, which we are not getting, and the only source then you have is of supplements, and that is why we are prescribing more and more supplements these days.
Doctor, how does one know that one is not getting enough calcium through their diet? What are some of the signs of this deficiency that you should watch out for?
It's quite interesting because there are no specific signs for vitamin D3 deficiency and calcium deficiency. People can just have vague aches and pains all through their many years before they can actually be diagnosed with having calcium and vitamin D3 deficiency. But in the last, as I said, a decade, we have been very good in India to pick this up, and this has also increased recently in the western side, where D3 has been blamed, or deficiency of D3 has been blamed for a lot of the conditions. So key thing is generalized aches and pains, body aches, joint pains, or symptoms which cannot be explained directly for some particular condition. And the easiest way to diagnose this is by a simple blood test, like a vitamin D3 blood test. You can have calcium blood test, and then of course then you have specialist test.
Okay. So these blood tests are part of your regular blood test package, or do you have to go for it, when the doctor prescribes it?
So now most of the corporate hospitals and even the middle class hospitals offer these tests almost over the counter, you can say. So a lot of people are having these tests, and all the health packages invariably at any age group have these tests included in their packages. So you don't need to get any special test, and invariably any lab will do these tests.
Okay, and a lot of people, because of the level of awareness, they go to the market and they get supplements. Mostly there are multi-level marketing friends of theirs who provide these supplements to them, and they believe that they're spending a lot of money and these supplements are expensive, so it's good for them. It's basically available over the counter as well as through their friends. So would you recommend that they continue something like that?
So I have a very mixed practice, and I get a lot of patients from the western side, so US, UK, Europe, who have been on supplements, who say they've got it from X country and hopefully it will be good. And when you actually look at the amount of calciums and vitamin D3 there is, it's not enough to make a complete supplement. So these are good for people, say you in a normal day to day you need 3 glasses of milk,
right?
But if you have only 2 glasses, this tablet would be probably enough to supplement that. But if you're really deficient, then you cannot expect that these tablets will help you in overtaking taking care of the deficiency, and that's why you need to follow what your doctor advises to take those medicines.
Okay. Also, a lot of people, when they have been prescribed calcium supplements, like women during their pregnancy, menopausal women, they refuse to take the supplements because of bloating sensation, or sometimes they have read somewhere that you need 1000 mg of calcium, and the value of or the amount of calcium in the pill that is prescribed is higher than that. So what is it that they should keep in mind? Is it okay what they are doing, or they should do something different?
I think it's a very interesting and a very excellent question. Yes, a lot of patients whom I prescribe say twice a day tablets, and they say it's 1000 mg, so 2000 is too much.
Right.
But the key thing is when you're taking 2000 mg or 1500 milligram, the amount of calcium absorbed is quite less, and that is also influenced by whatever else you are taking along with your food. say like tea, coffee or any other things which you take reduces the absorption of calcium.
Okay.
So you can imagine of the 2000 only less will be amount of calcium will be absorbed. From there the calcium goes into your blood. Now you also require vitamin D3 as a carrier or as a supplement to transfer that calcium into the bone. So if you take enough calcium but do not take D3, the calcium will just go out of the body. So you need adequate vitamin D3 that transfers the calcium from the blood to the bone, and that is why it is important to take higher level of calcium. And the second part of the question was, some people say they take X amount of calcium, so you have calcium carbonate, but they cause bloating sensation. My advice to them is try some other supplement from another company or something, because not all companies make the same amount of calcium.
The formulation is different.
The formulation is different. So one company's bloating sensation may be better with the other company. And also constipation is another part. A lot of patients, my patient says this calcium or calcium is giving me constipation. I just tell them switch it over and they are probably happy with it.
Okay, so the idea is to vary the brand till you find a supplement that is suitable for your body type.
Correct.
And what about women in general need a higher level of calcium during their adolescence, during their pregnancy, and even post-delivery, which is an area which is largely neglected. So for how long should they continue this? Should they give a break in taking the calcium supplement? Because many women are concerned about, calcification and excess calcium deposits and stones and things like that.
Correct. So especially for pregnant women and women who are lactating, so breastfeeding, these are the people or the group of people who definitely requires more amount of calcium. So as I said, if you take 3 glasses, then for them you require more, which is physically not possible, and that's why they definitely require calcium supplements, and they need to take it till they are breastfeeding and they have stopped that.
Okay. How long after they have stopped that as well?
Till an adequate amount, till they're feeling better. Okay, so I would say at least a year even after pregnancy.
Okay.
Now exactly it's not given in books, but I would definitely recommend it because they are in negative balance. So to put them into positive balance, you need calcium. And yes, for a year or 2 years, taking calcium will not increase any other risk of calcification or kidney stones. Yes, a lot of patients come to me with that risk, but I just tell them take a break and then start again. Except they can prove themselves that they are taking enough calcium from other sources or natural sources, which in India is slightly an issue.
Okay, why is that so? Why is it difficult?
So again, so if you have a balanced diet with 2 glasses of milk, everyday curd, paneer and other forms of calcium sources, then yes, you do not need to take supplements. But the issue becomes if you take too much paneer and take other supplements, weight is again another issue. So to balance that, people cut down on their food, but that actually means they're cutting down on their calcium intake, which is not good.
Okay. Doctor, what are some of the warning signs of calcium deficiency?
So a lot of patients, so at present I have 4 or 5 middle class affluent young females who have had stress fractures. Now what are stress fractures? Is fractures which occur because of your day-to-day activities, and this is because of abnormal bone. So these patients came to me with just pain in their foot or around the leg region, and by x-rays and MRI scans I diagnosed that they had stress fractures, and this is because of their abnormal calcium intake, low vitamin D3 and excessive activity. Excessive activity in terms of just normal walking or going to the office, nothing else.
No gymming or
nothing. And this is what has led to the stress fracture, and this is the cardinal sign. And pain even before that, unexplained pain, is probably a warning sign that the bone is not happy.
What is an unexplained pain? How would you define that?
So there is no trauma, it's just coming over a bony area, not over a joint. And if the x-rays and everything are normal, then I investigate them further. Not just giving them minor painkillers, of course, for 10 to 15 days, but if beyond that, then I investigate them to find out if there's any issue. One of the patients is actually my wife as well, where she has also had a small amount of fracture because in her foot, because again day-to-day activities, running around too much, and poor nutrition as well. So it doesn't help being an orthopedic surgeon not taking care of your partner.
Absolutely. So this stress fracture and everything indicates that you have osteoporosis, or is it a warning sign that you could have osteoporosis later?
So WHO, the World Health Organization, has classified the bone type into different. So one is a normal, and if it is weak, then it is called osteomalacia.
Okay.
And if it is weaker than that, so that's when you do a DEXA scan, which is a way of testing how good the bone quality is. That is called if it is minus 2.5 or below, then it is called osteoporosis.
Okay.
So as age progresses, people go from normal to osteomalacia to osteoporosis, or people can jump straight from normal to osteoporosis.
Okay. So is there a way to prevent that? Or, are you at high risk of that? Are there certain people who are at a higher risk of osteoporosis?
So the most common cause is women postmenopausal.
Okay.
And postmenopausal, because of the hormonal changes, what happens is the females go into negative balance quite quickly. So as I said, from age 30 to 35. So
Right.
all women definitely about 35 should be taking calcium supplements.
Okay.
At the same time, should start doing some impact exercises. Now that's slightly in contravention to what, if your knee or foot and ankle issues are there, then you have to be careful.
Okay.
But impact exercises leads the bone into a positive state.
Okay.
And hopefully will prevent or prolong the negative balance.
Okay.
So these are the main things, and adequate calcium and vitamin D3 supplements
To delay the onset of...
to delay the onset.
Okay.
Also, one of the groups, so we spoke about the postmenopausal group. There are other women group, especially people who have had their uterus removed, also people who have their ovaries removed, or breast cancer patients. These are the group of people who need to be really looked at, because they have endocrine issues, so they have
Right.
hormonal issues,
Right.
and they are on a lot of hormonal tablets.
Right.
So these are the people who really should be having, as I said, the DEXA scan, the special scans for the osteoporosis need to be done regularly, and if it is picked up early, they should be treated appropriately.
In what way is a person treated once they're diagnosed with osteoporosis?
So depending on what degree, as I said, so it's normal, osteomalacia or osteoporosis. If they are definitely proven osteoporosis, that means the WHO or the T score minus 2.5 and below, then they should be treated appropriately in the form of, in India and worldwide, we have bisphosphonates.
Okay.
So these are drugs which can be given intravenously as well as orally, where these help strengthening the bone.
Okay.
Okay. Now the good thing is they strengthen the building blocks of the bone, but the downside for this is this removes or this reduces the cycle of bone. So as I said earlier, the bone is a living tissue, so the bone is taken off and then bone is deposited. That's what normal bone happens.
Okay.
In bisphosphonates, the bone removal is stopped.
Okay.
Okay, but what happens is, because the bone removal is stopped, bone deposition over a period of time also stops. So
Okay.
that's why they should be given only for maximum 3 years. And I've had a study looking at abuse of bisphosphonates.
Okay.
So that's what my paper is, and that's been accepted for publication. It
Okay.
should be coming out shortly as well. So this is the first stage of treatment.
Okay.
If it is severe, then there are other drugs which can be used as well, like a synthetic parathyroid hormone. So parathyroid is a gland in the body. It secretes a hormone which helps in bone strengthening as well. So that can be used as well.
Okay.
But again, this has to be under the guidance of the orthopedic surgeon and an endocrinologist.
Doctor, apart from stress fractures, what if you have a regular fall and a fracture? Is that also an indicator of osteoporosis?
It's an excellent question. So if you have a middle-aged or slightly elderly patient who just had a minor trip and fall down, and invariably they have a wrist fracture, and these are called fragility fractures, where you don't have a high energy trauma. If a patient has these, what we call as a fragility fracture, the chances of having another fracture like a spine fracture, which is of the vertebra,
Right.
or the hip fracture, is significantly higher in these patients.
Okay.
So patients who have one fragility, going ahead in the next 6 months or 1 year, another fracture, the incidence is very high.
Okay.
And to prevent this, the key thing is for these patients to learn how to prevent falls. So
Okay.
make their house or the working environment fall proof.
What are some of the ways in which they can do something like that?
So for instances, the most common way, especially the elderly patients fall, is they get up in the night and they're going to the washroom and they trip over some object. So they make sure that the space from their bed to the washroom is clutter proof. There is nothing in between. If they have carpet, the carpet does not have any rolls or anything. And so they know exactly which space they are living in. And these are just some minor things they can adjust, which will prevent any what you call as a fragility fractures.
So if you have any more queries, don't forget to post them in the comments below. And if you like this video, please subscribe and don't forget to share it with all your friends. Thanks for watching.